This child, Trisha Mandal, she is 12 years old. She came from a remote village of Adilabad district of Telangana. She was absolutely fantastic, all right, without any problem, probably 3 months back. Then suddenly she had a history of fever. So that was a viral fever, followed by she developed recurrent vomiting and breathlessness. So the child who was going to school, who was running, jumping, doing everything, suddenly got bedridden. She was unable to walk and go to the toilet also. To do day-to-day activities, she was unable to do that. She was completely bedridden just after a couple of weeks from the history of viral fever. Then they went to several places. There they got treatment for heart failure. So basically this child's heart was completely damaged, which is called myocarditis because of viral fever. So this myocarditis reduced the heart function to a very greater extent from 65% to 10%. So then they got treatment at several places and almost 2 months passed, but there was no improvement in signs and symptoms. So they approached us. Somehow they got some reference for our hospital. They reached us. We evaluated, we counseled the parents, we explained them that probably heart transplant is the only option, there is no other option. And if you are living like this, probably child may not survive for longer time. So they agreed. Then we enrolled her. We did all investigations to find the suitability for transplant. Then all investigations came out to be optimal. Then we enrolled her in transplant list under Jivandan. Then in the meantime, we started looking for donor heart, because that is again a very important point. The blood group of the patient should match, the size of the patient should match, because it is a pediatric age group. If it is an adult, probably the size doesn't matter. But since it is a pediatric age group, the mismatch will cause a lot of trouble for us post-operatively. So luckily we got a donor who was from the city. She was in Aware Global Hospital in LB Nagar, and she was brain dead. We requested the parents convinced, they agreed to donate the girl's heart. The girl was 14 years old, so matching was perfect in terms of weight, in terms of age, in terms of size of the heart. Then we planned for surgery. We took government approval from Arogyasri. They were fast enough to give approval immediately as soon as we put the request. And then we planned the surgery. One team went to Aware Global Hospital to harvest the heart from the donor. The other team stayed back in the center at Continental Hospital to start the process, so that everything will be ready by the time the heart reaches from Aware Global to Continental. Then the Hyderabad Traffic Police provided us the green corridor, and within 45 minutes to 1 hour time, we reached from LB Nagar. The team which was carrying the heart from there reached to Continental Hospital within 45 minutes to 1 hour time. In the middle of the night, we started heart transplant. It took almost 2.5 to 3 hours. It was quite fast. Almost 2 to 3 hours the surgery was over. There was no intraoperative problems during surgery. It went very smoothly, uneventfully. And then post-operatively, when we shifted the child to the ICU, child was on ventilator, on heart supports, inotropic supports. And the hemodynamics were very stable. Hemodynamic in terms of blood pressure, heart rate, saturation, everything was okay. And the child recovered so fast without any bleeding. Normally in this type of patient, when we do transplant, there are multiple places where we put stitches. So in this particular case, usually what happens, the chances of in heart transplantation, the chances of bleeding also is a concern post-operatively. So in this particular child, there was no bleeding, absolutely very fantastic recovery without much bleeding. And within 4 to 5 hours time, we could take her out of the ventilator. And then within another 24 hours time, she was out of the heart supports also. So in 2 to 3 days time, she completely recovered. She went to the ward in 3 to 5 days time. And we observed her in the ward for another week. And during that time, her blood parameter came down to normal. There was no infection. She started walking. She started doing her regular physiotherapy, and her appetite improved, her weight improved, and we were quite happy with her progress. Then we discharged her. Usually what happens after surgery, in a month we do the biopsy to find out whether the heart which we implanted, because it is a foreign heart in child's body. So body has to adjust, body has to cope up with that heart. So suppose body is not accepting that, that is called rejection. So to find out whether the heart is acceptable to the body or not, we do myocardial biopsy. That we usually we do after 1 month of surgery. That we are going to do shortly. First we do 1 month, and there is a certain specified interval, 6 months, then 1 year, something like that. So that we follow that protocol and we do intermittent biopsies. So if the biopsy shows positive sign, that is good for the child. And only concern is post-operatively these patients are more prone for infection because they are on immunosuppressive therapy. So if as of now child's the level which we maintain the immunosuppressive therapy level, it is fantastic. It is maintaining at a normal level with minimum dose of the immunosuppression. Probably that is the reason child is absolutely all right without any infections, is perfectly fine. We discharged her almost like couple of weeks back, and in 2 weeks time she came back. She is doing well. So hopefully the things will continue in the same way in the future.